Thank you. So as you already given introduction, so I'm going to speak about the sense of pharmacy digital transformation. I think that digitalization is really, disrupting every profession. So in pharmacy as well, there's a lot of health IT interventions going on, and which is very important. Especially people just came to know about this, technology value when this kind of epidemic happens. So, but this disruption was going on from a long time. So, sorry, this is a brief introduction. As already mentioned, that I'm working as an assistant professor at Taipei Medical University in the Global Health Department. I'm also working as digital health consultant and principal investigator at ICHIT Center at TMU as well. I'm also fellow of Australian Institute of Digital Health, Australian College of Health Services and Management, and Royal Society of Public Health, and also committee member for the International Health Literacy Association, and also I have held the editorial positions as well. So in pharmacy, of course, I cannot just enclose in 20 minutes, what is the value of informatics in, pharmacy profession, but I will try my best to summarize and sum up and, to keep an interest. As we know, the data is growing bigger and bigger. We have different platforms. This was achieved a few years back, and I just took from the Google. You can see here the people used to talk about the oil are more valuable resource in the world, but now people are talking about the data, which has a more valuable, resource among other resources. And so many different platforms are generating a lot of information. For example, Uber, Google, Facebook, and a lot of, because we are sharing a lot of pictures, a lot of information, comments. If you are doing, searching, you can see all the information is available on these kind of platforms. So that we are growing data every single seconds in, huge quantity. But what we can do with this data, and this data is not only in these sectors, but also in healthcare sector too, because there are so many patients, so many drugs, so many, kind of information in healthcare too. So first of all, I would like to talk about like, what is big data actually? So big data, people, assume that big data, maybe, you just have to have some kind of terabyte or some kind of, no, it's a special kind of large data set, which is very, very complex. And you cannot do it manually. So you need to have a special computation powers machines, which can help to do it. And you need to have some special kind of tools, which cannot be used the usual tools which we have. So it's a kind of collection of data set, which is large, complex, and it becomes difficult when you're using the hand database management tools or traditional processing applications. And usually it's multidimensional, geographical, and temporal. But when we are having the big data, when we are talking about how to analyze this data, so you may also have heard about the artificial intelligence, and artificial intelligence is these days are getting more boom, but it has been there for many, many years before. So AI is actually artificial intelligence is from the machine mimics cognitive functions that human associate with other human minds. So for example, you're teaching computer to do this kind of function, then computers start trying to do that after learning, and they will try to solve the problem. So you are trying to give machine some information and some data, and teach them, and then they learn, and then they do the process automatically. That's called artificial intelligence. Means we are giving them artificially some kind of knowledge and intelligence. So when we are having a lot of information, like big data, so we can create computers to do some kind of task for us, which the humans, it will save the humans time, and humans can do something more besides that. So what's the function in healthcare actually? So in healthcare, the basically providers, they are caring for patients, and then we have electronic health records these days where a lot of information is generated and stored through the electronic health records. Then we have biomedical research through that, and then we are also having some local registries, some national registries, and regional different registries. And then we are getting the information, and we're trying to prepare some standards, preventions, and treatments based on that when we are collecting the information, because those informations are recorded, and we can have, we can track back to see if we want to see what this patient has done before and what were treatments were going on. And based on that information, we try to create some protocols, guidelines, and educational materials, of course, because we have an evidence for that. And then based on that, the information decision support system and of CPE systems are also based on this information which generated from the EHRs, and then it leads back to the providing the care to the patient. So the ultimate goal is to providing a good care to the patients, and this all information can be helpful in different purposes. Since I am based in Taiwan for almost 10 years, but I've been working with international collaborators too. In Taiwan, why Taiwan is really having this good position in technology in healthcare is because Taiwan has a strong ICT infrastructure. If you are visiting one hospital and then you are visiting second hospital, and the A hospital can access the information for the B hospital for the same patient if you are interested in the physician. But it is only allowed to the one who is authorized. For example, physician, if interested to see the history of the patient, they can able to access the information of that particular patient. So it's not like open for everyone. And then there is a very high outpatient visits. Like, you can see the 15 visits per year for per person. And the diagnosis and the drugs coded by physicians themselves, not the, they don't have coders for that. So you can see that they are skilled people. They are the one who are giving the first line, consultations. And then there is accurate e-prescriptions where you can find the drugs. And why there is an accurate e-prescriptions is because there is a national health insurance system which usually randomly check the prescriptions. So for example, if you have a drugs in the prescription, but you don't have any diagnosis for that drug in the prescription, and you're just listing the drugs, but there's no diagnosis, then NHI will give a plenty to the hospital because they are going to claim, and then they will say, oh, because there's no diagnosis, so we don't know for what purpose you are prescribing this drug. And for example, if there's a different diagnosis and drugs are different, they also, it has to be gone through the audit process too. And there's a 23 million people, so you can imagine how much information through the EHR, and very standard information structure. So what is coming first of all is the patient safety and how the technology can help in that too. So you can see here there's a problem of medical error is a leading leading cause of death, and it was reported in 2013 in US. After heart disease, cancer, medical error is the third leading cause. And how many people usually suffer from that. So what this big data, this AI can help is, we have built here the advanced electronic safety of prescriptions model based on AI, in which we just use the prescriptions data, which has diagnosis and drugs. And you can see here from the figure that, sorry, I just use a pointer. Okay, so you can see here, there's a drugs D1, D2, D3. If, for example, assume this is a one prescription and there are 5 medications, we try to build this one that if this is the diagnosis, what are the most relevant drugs to this one? And based on the prescriptions we had, we almost got 103.5 million prescriptions from 2002 from the NHI for all the 23 million individuals. And we try to see this one and building this model. And this was very interesting that, we can see here then these prescriptions, we tried to use a machine learning model, and after that, we able to publish in 2 international journals too. So we did not only work on the allopathic medicine, we also try to see in the Chinese traditional medicine. Like in Pakistan, we have homeopathic medicine, some other medicines too, along with the allopathic medicine, because people usually try to take for one disease one kind of medicine, for the other disease they are trying to take the other medicine. So this is the same case in Taiwan too. But what is the strategic position of Taiwan is that even they are having the traditional Chinese medicine, it's also recorded in the electronic health record. So they also have the standard schema for that too. So this big data, of course, it will be very, brief for now you to explain that how we, really established, but I'm just giving you an example that if we have a large amount of prescriptions, we can able to build using AI models to have this model to give us which drugs are more relevant to which diagnosis. So for example, if physician is prescribing some medicine which is not relevant to that particular diagnosis, or maybe the age, or maybe the subject is pregnant, or some different trimesters, or maybe diabetic, or some drug interactions based on the latest information. So this algorithm can help to detect. And if someone is just prescribing without any diagnosis, this also can help to tell that why. But there are some drugs which, for example, like aspirin, usually the patients ask for randomly, and it doesn't have to be with a particular diagnosis too. So this also helped to overcome this kind of issues too. So it was very interesting. And this is another using the big data. We try to visualize this data. Means if you have information in Excel sheets or other sheets, sometimes it's hard to really recognize what this number means, because most of us are working in a field, so we don't really have a very rigorous statistics background, and we don't understand exactly what these numbers, or what is statistic significant, or how it is. So visualization is one kind of way that where you can have a visualization and you can able to understand this. So we use this and Taiwan data too, and we try to see the phenome-wide association. Why we call phenome-wide is because it's a physical associations from disease to disease. So for example, if one patient has one disease, and then what are the more likely other diseases that patient have in that particular time duration. So you can see here, if you from the group, if you choose this one, the different group, age group, and different disease code, and it will give you the chart here like this with the odd ratios and co-occurrence, that how many patients occurs together, how many times it occurs together, and what is the odd ratio for that too. And you can even able to find the related publications, because it's also linked to the publications too. And you can also able to download the data set, because the data is also available for open too, but you have to just fill the the information asking for the request, so we can know that who is asking for that. So this is another thing. So sorry. So this is another out of this is a map. It's called disease map. Similar to that, it's exactly we use this, but we try to visualize, as I already mentioned. So you can see the circle of the different color circles. Different colors represents different disease system. Circulatory system like red, the green, like respiratory system. Blue is like abdominal, and so it's like a gastrointestinal system. So these are the different systems. And the codes you are seeing here is the numbers are actually the disease codes. And you can see here the distance between the two bubbles is showing that how close these diseases are associated to each other. So if the patient has already one disease, what are the more likely disease he or she is got during that period. And so it shows that how close are. So if you're getting a disease, and more likely you will get the B, which one and which age, something like that. So this is very interesting, and it's also available open too. So I have already put the link here. If you're interested, you can go through and play with that, and you can see the different age groups as well. So you can, it's very interesting to see in the young adults what kind of different diseases, and in the older age, and in the middle how it is. But the limitation of this one is that this is a 1 year window. So for example, there is a flu cases a lot, and some other, but some of the huge big diseases, chronic diseases like cancer, is hard to see, but you have to expand that accordingly as well. So we also managed to publish this in 2 international journals, in JAMIA and CMPB. This is another visualization. Why I'm talking about this visualization is because most of people, we are working and the data we are generating a lot is easy to interpret if it's visualized well. So this diagram is called Sinkey diagram, was used in the engineering background, and we try to use this in healthcare. And you can see we try to emulate into the CKD disease. So we try to see pre-CKD and post-CKD, and we try to see the what kind of the diseases the patient when they were healthy, and then after when they got the CKD, and then after CKD, what kind of and how long they will have the dialysis, and the when the patient is stable and there is a mortality happen. So it was really interesting to identify the patients, and the physicians, it's very helpful to have a treatment plan to see which patient is at more risk, and and how to allocate the cost as well. As you know, the dialysis is very how to say costly here too, and when you're covering under NHI too. So this is the same the Sankey diagram you can see here, from the zero index year, pre and post. So what the patient were having before, and then what the patient were having after CKD. So outcomes, and the different colors is showing the different disease. You can see here the side, there are different color bars too. And so we also published 2 papers out of this project in 2 international journals as well. This is another project of big data and AI, which I would like to share, is that we are generating a lot of images as well. And you can see the different smartphones, they can recognize you from the faces as well. You can open the phone. Nowadays, on the Google or other platforms, you have to select the images, and sometimes Facebook, it will ask you to select your friends. So if you forget your password and something like that too. So how the AI is trying to push, information to each other and getting, access. So we try to use in healthcare, and this is a mobile application. If someone has any mole on the skin, they can just take a picture, and based on this AI algorithm, it has a 90% accuracy. It can help to predict that whether you have a risk to have a melanoma and whether you need to visit a doctor or not. So this is very interesting too, because sometimes it can help you to save unnecessary, visits to the hospitals. Of course, cost as well. And of course, this image data is very useful too. So most of people, you can screen this, and you can save, a time as well. So this is another project we have done using this big data, long-term drugs and cancer risk. This is because most of time the pharma companies, they don't spend time after, once they have the trials went and the drug is marketed, and there are just very few trials going on. And nowadays it's even getting more unethical, because people don't want to volunteer for just cancer risk and stuff like that. And most of the organizations are also concerned about this ethical issues. So for having this big data, we can do some pharmacoepidemiological studies too. And the thing is, the data, of course, has to be accurate. The quality of the data should be good. But what the interesting thing we can do from this one is, we can see different age groups. We can see what kind of drugs patients are taking, what kind of risk they have, in which kind of gender and stuff. And we can even define the daily doses. We can also define the, when is the index stage, when they started this one, the drug. We can also control some of the variables, what kind of the other diseases and stuff like that too. And we managed to publish several studies. The one of the study I'm sharing with you is published in 2015, which is called Is Long-Term Use of Benzodiazepine a Risk for Cancer? And interestingly, we found that there are some of the benzodiazepine drugs which has really, increased risk for brain cancer and some other cancers. We found the great association. And this was based on the epidemiological data, of course, the observational health data. And this study, along with other studies, then after one of the author from US filed a petition after, the benzodiazepines are in the market for a long time. He filed a petition to ask FDA to revise the guidelines for benzodiazepine prescription, and he cited 2 of our studies in his petition, which was an honor for us too. So means we are not the only one. There are some other researchers who are also trying to identify the risk for long-term use drugs, and the benzodiazepines among them too. And you can see that after many years, people are still, figuring out these drugs and their long-term effects, and especially for cancer, because the cancer is not usually prominent in 1 or 2 days after use. If it has to be, like take a time, for example, 2 years, 3 years, and we don't know exactly. But in this study, we try to see at least minimum 2 years use, and from 2 months to 2 years. So here, I'm not trying to say that all the drugs have carcinogenic effects. Some drugs have mutagenic effect too. So this is being a pharmacist, having healthcare data, it's our responsibility, and we need to take an interest to see how we can contribute using this big data, healthcare informatics field and bioinformatics field. So there is another study we published, does aspirin use reduce the risk for cancer? And we interestingly found that the aspirin use can help to reduce the colorectal cancer. And it's available as well. So means there are some drugs which you are taking to help you to reduce some kind of cancers too. And then we did not just based on the observational data, we also try to see that how the bioinformatics approach means. We also try to see the publicly available data of genomics and the proteins data as well. So we try to compare over phenomical results as well. So we also use this data to see some policy implications as well. For example, the antibiotic prescribing behavior of physicians when there is a policy introduction, and then we try to see that how the physicians they were changing their behavior to change the prescribing of antibiotics to go based on this the guidelines. So the data is not only limited to the the NH this electronic records. There are people who are also posting on Twitter, on Facebook. So we also have done some studies using the Twitter database and also the Facebook. This is one of the example using the drug adverse reactions people were sharing on Twitter. It's also one of the collaborative projects you can see here we published. So because sometimes people argue about the local population, that how you can generalize these results to the international other population. So we also try to collaborate with other international partners. There's one consortium, and we also managed to publish one study with the international collaborators from Columbia University and from Korea and other, and also got in the news. And we also established a chapter where we can share the results with the other collaborators among countries too. So nowadays the data sharing is very important. So you have to know at what level, at what extent you should be sharing. These are the two studies I'm sharing. It's an international collaborative projects. You can see the multiple countries were involved. The first of the application of common data model to rank the pediatric drug users in 15 drug classes in South Korea, Hong Kong, Taiwan, Japan, and Australia. All are these close to each other. And what we interestingly found that there were the different prescribing behaviors for these particular drugs. And same for a multinational investigation of fracture risk and antidepressant use by class, drug, and indication. So we also collaborated this with the McGill University from Canada and from Harvard Medical School, Brigham and Women Hospital, and TMU here too, and also with the UK. So you can see that how you can try to compare the drug uses and see what are the risks and how the results can be generalizable and compare the interesting findings with each other. So AI is in pharma is actually getting more popularity these days, and you can see that everyone is talking about that. For example, in developing new drugs to tackle the disease which are previously were difficult to tackle, and for drug adherence, people are using AI, and also for clinical to make a clinical sense of the data using AI too. If you have a huge large amount of data and you don't know what is exactly how to do that. So you are using some AI tools to interpret the information, to run the information, and to find the correct patients for clinical trials as well. And you can see that most of the tech companies are investing a lot as well. IBM Watson, they have some Watson for oncology, and AI is also the Apple is also building some AI models to screen, for example, like children for autistic disorders and stuff like that too. So it's not only the pharma companies or the normal companies, but the tech companies who are working on other things are also trying to come into healthcare. Now, there is people are talking about wearable devices. I think in pharma, it is also very important. We can have, the good adherence. We can monitor patient and we can engage them. We can do counseling. We can see that when they are taking a medication, we can give them a reminder. We can, have some real-time evidence. So there are so many things can be done using this wearable devices, which is getting more access instead, where there was a traditional way. The one of the good thing is all this information can be connected and you can have this, in a chart and bars too. So which will be easy. The current scenario, as you can see here, is the people can access all the information in their mobile app, and even they are writing if somebody's, disabled, aging population, no matter you're working in office, all the information can be get together and you can have a real-time graphs together. So we can have some prediction models where if the person is at risk, for some cardiac arrest, some other kind of if they are doing some athletic exercises or riding and they have some risk, we can able to predict earlier than they are going to have some kind of fatal event. So why it is important is because clinical trials also use wearable devices nowadays, and for data collection, for medication reminders, and saving some cost for personal trials, and it's more convenient as well. So the stakeholders, for example, WHO, they also take initiatives and they form a digital health technical advisory group just this year. So you can imagine how this technology is evolving. And also US FDA also formed some kind of the policies where they are having regulations for AI algorithms, where if you have an AI algorithm to detect some kind of disease or predict some kind of disease, you can get an FDA approval too, and they can evaluate based on that too. So in future, we are going to have these kind of chips as well. So we don't, these chips will replace the all human subjects in future, I believe, because this is how the companies are working on. And this is just a quick short video. So this is a chip. You can see this is it's indicating some organs. You see the lung cells, capillary cells, and you can see this is the gut. You can see how the cells are. And inside the chip, you can see here, the cells. You can see here, the whole system. Yeah. So in future, what we are expecting is, there will be smart homes in the shopping center. There will be sensors. There will be smart cities. There are some things already going on. Smart homes are already there. Smart hospitals are already there. There are smart pharmacies already established. And now there's just e-prescription totally, and you don't have to bother yourself, and you have all the information and stuff. And this all the information, the sensor, the technology can accumulate and to make some sense out of that at one platform, showing in a way of, graphs, charts, and having some good prediction models for that too. These are the book chapters we have recently. You can see the health system accreditation databases in Pakistan with the prestigious editors from different countries. The main editor is Professor Jaffrey from Australia and from UK and other countries. If you're interested to see, how the health IT technology journey, in different countries and what are the status in Pakistan. This is a recent paper we have, AI for earlier medicine, the earlier medicine term we coined here. The authors are one from the one professor from TMU and the one from the Harvard Medical School. We had this one kind of the proposal that AI can help to have the earlier medicine based on the prevention, earlier prevention at primary level, secondary level, and tertiary level. So you can have earlier prevention also at the 3 different levels using the AI, and it can help to screen. For example, like now COVID-19 issues is going on. So if we can use AI, we can help to mitigate a lot of issues, and Taiwan has done something like that too. So this is the one course which is going on online, and it's a free course available on FutureLearn. Anyone interested in AI and big data and global health improvement, feel free to take this course. And for the certificate, you have to, pay. If you want to get the certificate from FutureLearn, you have to pay. But if you just want to take this course, Learn, is fine. And if you're interested, I can even give you a certificate for free on my behalf directly. And what I conclude is, there is an opportunities in this new domain, being in pharmacy. People are not aware that how they can move on into the technology, being pharmacists, what we can do in the technology. Actually, there are huge opportunities in health informatics, in bioinformatics. There are many other things going on, and they need pharmacists actually in this domain. And most of the pharma companies are struggling to hire with the pharmacy background, interesting in technology too, as well. And most of the pharma companies are investing a lot of money in this domain as well, in observational health data. So it's an exciting journey for early prevention, and there's all types of data available, including EHR, image data. We have AI for virtual trials, and of course, we can bring humanity back to the medicine. Thank you all for having me here. And if you have any question, you can feel free to drop me an email.